Welcome to Trial Site News Roundup. Today we'll be talking about a story about a Belgian virologist who is proposing a plan to eradicate COVID-19 in 6 weeks by using ivermectin. Then we'll talk about the FLCCC's response to Merck's statement last week, in which they challenged the safety and validity of ivermectin studies. The Frontline COVID-19 Critical Care Alliance's response? Well, they say that data shows ivermectin's strong efficacy against COVID-19. And so we're going to talk about this. And so, from Trial Site News, I'm Adrian, and the News Roundup starts now. As recently reported in the publication Hospital Pharmacy Europe, a Belgian virologist named Mark Wathelet argues for the immediate use of ivermectin as a low-cost, off-label treatment to get the pandemic under control in Belgium. Dr. Wathelet suggests that after 1 year and billions of dollars spent by governments such as those here in the US, only one drug is actually proven to have benefits: dexamethasone from the recovery trial for patients who are already hyposemic. Then, Dr. Wathelet pointed out that there is one drug that had received little attention up until recently, which shows promise, and that, of course, is ivermectin. He referenced the meta-analysis from Dr. Tess Lowry in the UK, and said that based on 15 randomized controlled trials and observational controlled trials, the ivermectin treatment reduces death by an average of 83%. He went on to say that based on the Dr. Lowry meta-analysis, the drug also reduced the risk of deterioration by 53%. Furthermore, Dr. Wathelet said that the drug used as prophylaxis given to healthcare workers or relatives can reduce the risk of infection by 88%. Now, Dr. Wathelet's proposal hinges on the use of ivermectin at all stages of COVID-19 infection, a multi-pronged approach, as advocated by the Frontline COVID-19 Critical Care Alliance. Critically, it calls for ivermectin prophylaxis to control the spread of the disease. He suggests 2 doses of 0.3 milligrams per kilogram 72 hours apart every month for healthcare workers and for family members of those who test positive for SARS-CoV-2. He pointed out that transmission within households is one of the major drivers of the pandemic, and prophylactic ivermectin use could cut this dramatically. Contacts of cases should also receive prophylactic treatment. And then the next step is ivermectin for early treatment for people with symptoms of COVID-19 infection to reduce the severity and duration of the disease. At present, only paracetamol is recommended. The third step is the use of ivermectin in severe COVID-19 infection to reduce mortality. However, Dr. Wathelet acknowledged how it would require tremendous leadership for successful implementation of his plan. Scientific counter-arguments and practical hurdles would have to be overcome. The most frequent counter-argument and hurdle is that there is insufficient evidence and/or that studies have not been peer-reviewed. Dr. Wathelet counters this by saying that Dr. Lowry's meta-analysis includes nearly 4,000 patients. Furthermore, the author of this analysis has systematically removed trials of low quality and/or high risk of bias, so it is hard to see how the estimates of effect size will be significantly improved by waiting for more studies. Dr. Wathelet went on to argue that it would be foolish to wait for the slow and flawed peer-reviewed process in the context of a pandemic when lives are at stake. Another common counter-argument is that the effect cannot be real because the concentration of ivermectin needed to inhibit SARS-CoV-2 replication in vitro was at a level that cannot be reached in the plasma in vivo in people. Dr. Wathelet countered this by saying that ivermectin is highly lipid-soluble and consequently tissue levels are higher than plasma levels. Ivermectin has broad-spectrum antiviral activity. It also has some anti-inflammatory activity as well. Several mechanisms of action have been identified, but it is not known which are most important, this according to Dr. Wathelet. Then there is the unspoken counter-argument, which appears to be a belief amongst decision-makers that vaccines will solve everything and no more treatment is required. Dr. Wathelet countered this by saying that he believes that this is wrong, because it will be many months before large enough numbers have been vaccinated to protect the population. Then Dr. Wathelet talks about practical hurdles that would need to be overcome. The first would be to actually make the drug available. Then, obtaining a supply of ivermectin tablets would be another modest hurdle because the drug is not in routine use in the UK. And so, Dr. Wathelet went on to ask the question, where does this leave us? He went on to say that ivermectin is cheap, well tried and tested over the past 40 years, and already available as a generic product in many countries. It is effective in countering transmission of SARS-CoV-2 and also in treating the disease. Dr. Wathelet went on to say that the evidence for effectiveness of ivermectin continues to grow and deserves our attention and action. Failure to act swiftly on this evidence might begin to look like dereliction of moral responsibility. Now, you can read the entire article by clicking on the link in the description below, and of course, we'll keep you posted on the story as it continues to develop. So for the second half of the news roundup, we're going to talk about the Frontline COVID-19 Critical Care Alliance, which has issued a public statement in response to a press release issued by Merck last week, which we covered in our previous episode of the News Roundup. When the Frontline COVID-19 Critical Care Alliance reviewed the Merck release back on February 4th of this year, which discounted the efficacy of ivermectin for the prevention and treatment of COVID-19, they were stunned by the fact that Merck provided no scientific data to support their conclusion. The FLCCC noted that the company's disregard for the most current medical evidence is an indictment of their uncorroborated position. Furthermore, the FLCCC believes that the pharmaceutical giant's press release will cause governments, health authorities, medical providers, business leaders, and citizens to retreat from pursuing a medical agent that, the FLCCC points out, according to their recent peer-reviewed and accepted publication to the highly regarded Frontiers in Pharmacology, the drug has been proven to be effective and globally available agent to prevent and treat every phase of COVID-19 disease. The FLCCC went on to note that with supplies of the vaccines running short, especially in low-income countries, people will be left to believe that there are no safe therapeutic alternatives, which they are concerned will result in rising case counts and mounting death tolls. Now, for more information, you can contact the FLCCC directly by emailing them at press@flccc.net. And that, my friends, brings our episode to a close. As always, thank you so much for taking the time to join our program today. We appreciate each and every one of you for being here. From Trial Site News, I'm Adrian, and I'll see you all next time.